afternoon. So my name is Kim Magoon. I work for a public consulting group in Maine's office, and I specialize in child welfare and substance use prevention evaluation. So I've worked on a variety of projects across Maine, West Virginia, Arkansas, Nevada, Colorado. Right now, I am currently the evaluation lead for the New England Prevention Technology Transfer Center, and I am joined today by my colleague, Kim Walter.
Hi, everyone. I'm Kim Walter. I'm a senior evaluation analyst at PCG. I also work on a lot of substance use prevention projects, some child welfare, and other public health projects. So I'm looking forward to this presentation.
So we have a couple of the introductory slides like Kristen just went through, so we'll skip over those. So this is the second part of a 4-part series on evaluation for substance use prevention professionals. We held that first session in December and really focused on the introduction to evaluation. Today's session is going to be a deeper discussion of the actual design of evaluation, and we're going to go over those objectives in just a minute. But if you're interested in the next part of the series, in April, we're going to be continuing this conversation for conducting the evaluation. It's going to touch on implementation, data collection, analysis, and then we're going to conclude in our series in June with actually using the evaluation to make data-driven decisions. And that'll focus on telling your story with your evaluation results, disseminating them to your stakeholders, and really developing actionable results out of that evaluation. So with this foundation, we're really hoping to empower participants to make decisions about conducting, implementing, and using evaluations for substance use prevention. So we'll spend the first couple of minutes today talking about our previous session. If you attended the series in December, you know we gave some folks some homework and we'll check in with that. If you weren't a part of that first session, don't worry. We're going to review some objectives for today's session, and then finally we'll have a short group activity to apply some of the skills and return at the end of the discussion here today. So for the webinar in December, we talked about a few reasons to evaluate. We went over the SPIF model.
Hey, buddy. Hi.
What the evaluation cycle looks like, how to set up a logic model and theory of change, and then when to think about hiring an external evaluator. So it was a pretty broad discussion, pretty broad introduction, because we had people from varying levels of evaluation experience and people working in various types of prevention. But following that webinar, we asked participants to complete some homework and utilize this worksheet to think about 3 action steps that they could take to start an evaluation. So we asked folks to think about what they would need to do, where the first step would be. Where do they need to start at the beginning and secure funding, or maybe in farther back and try to secure buy-in from stakeholders. We asked the group to think about barriers that might come up that they could foresee and maybe some possible solutions to that. And then third, we asked people to identify people or groups that they may want to partner with for an evaluation. So there was just 3 high-level questions just to get folks started. So the bottom of this form was also pre-populated. And once people got started, they could make notes about what was working and what wasn't, and where they needed the follow-up, and maybe where the New England PTTC could come back in to help. So I want to leave a few moments here for people to answer or circle back with folks. Perhaps you could put something in the chat. So were there any surprises if you did this work? Were there resources or information that you discovered that you needed, kind of tripped you up? Or is this a place that the New England PTTC could step in and really help you out? And were you able to start laying out some of those ideas? So I'll wait just a few moments to see if we get any thoughts in the chat. Okay. We're going to keep this form in mind and return to it at the end today because we're going to have some more homework for you for next time. But first, let's talk about designing your evaluation. So today's the objectives are really 4 parts. So we want to identify different types of evaluation, learn what kind of questions to ask and how to ask them, understand how to choose and define a sample or target population, and then identify the elements of an evaluation plan so you can really start putting pen to paper and laying things out. In part 1 of this series, we talked about developing a logic model. We talked about developing a logic model for this and a theory of change for an evaluation. I use this example as a fictitious evidence-based program I made up. It's called Smarter Start. So let's look at the example, and because we're going to carry this through with today's presentation as well. So in this example, it's a youth marijuana prevention campaign, and it kind of follows that if-then methodology for theory of change. And we'll build on this. So first, I have my assumptions that I observed that the marijuana use among high school youth has steadily increased over the last decade in Armstrong County. And I could empirically see this because I could use something like the NSDA, the National Survey of Drug Use and Health Survey data for larger populations. Maybe I've got some data from the school saying like that school suspensions are up, or restorative justice actions, or maybe there's a community level survey. But I could see that has empirically changed. I think this is because that lack of knowledge regarding risk of marijuana use, and there's a decrease of perception of harm. The people just don't know enough, and they don't think it's harmful. So these are the 2 variables that I can also use data to see changing. Maybe it's a change in legislation with recreational marijuana being legalized in some states, and then maybe I can also see perception of harm in reported surveys going down. So we're going to do this activity. We're going to provide Smarter Start programming to all 3 of these school districts. And then hopefully my outcome and long-term impact is going to be that the rate of the marijuana use in high school among these youth is going to decrease by 20% by 2025. So this is the example we're going to use, and we'll carry that through today. So as a quick reminder to that first session, we showed this figure as an example of an evaluation cycle. We spent a lot of time describing our program last time, and today we're going to move on to that evaluation design. So just keeping in mind where we are in this cycle. And then when focusing your evaluation design, to have greatest success, we really want to make sure that it's useful, feasible, ethical, and accurate. So we want to look at the purpose. So the purpose varies greatly from program to program. It could be used to focus on entire program, or maybe just certain parts of it. Evaluation can really be defined as the systemic collection of information across program activities. And in our example, we're going to want to know if the program is actually decreasing marijuana use for youth, right? So that's the purpose of our evaluation. We also want to think about who's the audience. So keeping in mind all your stakeholders, including those who the program or intervention interacts with, and maybe also those that it's impacting. So again, like we want to know if the school district, so the school district is definitely one of our stakeholders, right? So we'll want to know if the program that they're paying for and letting the teachers and students participate in is actually effective. So we have a few different stakeholders in this. And then the time frame for results. So evaluations are often bound by schedules and deadlines. They're beyond our control. So think about school calendars and funding cycles. They often have conflicting time periods. And if your reporting needs are short-term, then you sometimes can't ask the questions that require that long-term follow-up. So too often, especially with substance use prevention, we also want to see longer-term objectives, but we only have 2 years to complete that work based on the funding cycles. So you want to keep time frame in mind. And then how would the evaluation be used? So is a requirement that the funder has, or is there a specific format you have to follow? Are you able to think more broadly about disseminating your results? And maybe you can produce multiple products out of this. Maybe it's not just a report, but maybe you can produce fact sheets for your community, or infographics, or help develop social media campaigns based on this. So, but the degree to influence the program has on the evaluation findings is largely dependent on the research design used. So, for example, Smarter Start might become more fully integrated in the school curriculum if it works. Other school districts might also be interested in the program for their communities. So thinking about what you want to do with the data once you have it. And then we're going to really dive into the meat of the evaluation plan, because this is what today's presentation is about, right? Is how do we put pen to paper and make things happen? So we're going to talk about design, questions, methods, ethics and protections, and limitations. So does the design and the type of evaluation fit the need, need of the program, the purpose, the program budget? Are the questions aligned to meet those needs and purpose? What kind of procedures have been identified to gather that data and answer the research questions? Are there safeguards in place to ensure that standards are met, specifically for human subjects and vulnerable populations? Have you obtained IRB approval? Have you ensured that your design is equitable and ethical? And then it's important to document the limitations with your design. So in clinical settings, it's very easy to control for all of the elements. In real life, it's way harder, right? So sometimes your some of the limitations before you even begin, and other times they just pop up. So within the limitations, you can also document like contextual factors like COVID-19 pandemic that's thrown a wrench in everyone's evaluation plans. That's a factor, right? I mean, we have to account for that, and that's you've had to pivot and shift and make some different decisions than you might have without that thrown in. So Kim is going to talk to us a little bit about our evaluation design.
Yeah, so moving in, so once you've thought a little bit about your evaluation plan, really the first step is choosing your evaluation design. And you really want to make sure that that design obviously aligns with the program or intervention's goals and objectives, but also with the available resources you have. Often evaluations are done with limited resources, so you really need to consider that at the beginning of the planning process. Next slide. So there are three real basic types of evaluation designs. And within each type, there's a lot of different kind of subcategories of design, but obviously we don't have a lot of time, so I'm just going to keep it high level. So there's non-experimental, quasi-experimental, and experimental, or what's commonly known as a randomized controlled trial. So what this slide shows is basically the level of rigor from left to right, non-experimental being the least rigorous, all the way to an RCT, which is the kind of the gold standard and the most rigorous. It doesn't mean that because you can't do an RCT that you should not do an evaluation. It is very difficult in an applied setting to do an RCT. These are usually done when you have additional, not only financial resources, but research resources, right? If you're partnering with a university or an organization that has the additional manpower to assist you with this. So you can go back up to that slide, Kim.
Oh, okay.
Sorry. So for a non-experimental, really, this is a type of design that does not have a control group or a comparison group. So the best way to do this would be to at least ensure that you have some sort of baseline measure, so some sort of pre-measure and post-test, so you can look at some sort of change over time. Oftentimes, evaluation is an afterthought, so you can't get that baseline data. It doesn't mean that you still shouldn't do an evaluation, but again, like Kim mentioned, you have to be transparent about the limitations of the findings. For quasi-experimental, this is moving towards being a more rigorous evaluation. You do have a comparison group. However, it's not like a randomized, you're not matching intervention and control groups on certain factors like socioeconomic status or, different population characteristics. It's usually out of convenience. So a good example would be implementing a program in a school where you have, just a set of schools that are implementing the program and then another that are not, but it's really done not in any sort of systematic way. So again, you have to take this into account when you're analyzing and reporting the data. And then in RCT, you are randomly assigning, so in this case, schools to a certain condition. So that could be the intervention group or the control group. Again, this is the gold standard, but is quite difficult to implement in an applied setting. Next slide. So this infographic does a nice job displaying the different types of evaluation. So moving from, how to the why. So you start with the formative evaluation, which is looking at implementation processes, fidelity, capacity, all the way out to the impact evaluation. So when we do evaluations, we like to do both formative and outcome evaluations, and that includes impact as well. Oftentimes people will spend less time on the formative evaluation because what funders want and what different decision makers want is they really want those outcomes. But if you're only looking at the outcomes and you're not, finding that you're meeting your targets or your goals of a project, if you did not collect process or formative evaluation findings, it's very difficult to explain why the intended targets weren't met. So formative evaluation, incredibly important, really helps with continuous quality improvement. Next slide. So for a process evaluation, this examines the process of implementing the program or intervention and determines whether it's operating as planned. So these are just some example questions that you can use, answer with the process evaluation. So what is the theory of change behind the project? To what extent was the logic model implemented? What factors helped or hindered implementation? And was the program implemented to fidelity? Next slide. So for an outcome evaluation, so this is really assessing whether or not you're meeting those target goals that were established. Typically, when you're applying for a grant or you're designing your implementation plan, you have some clear, measurable goals. So, a good example would be reducing, alcohol consumption by a certain percentage over the program period. So certain questions you can ask are what outcomes were and were not achieved, were the outcomes satisfactory, and under what conditions were the outcomes better or worse. So this is where you can do some subpopulation, subgroup analyses. So did the intervention work better for certain groups? So for example, if you have an intervention, a simple question would be to look at gender differences or differences based on geographic area. So you can answer some really interesting questions looking at outcome data. Next slide. An impact evaluation takes outcome a little further, and it provides information about the impacts produced by an intervention. So those can be positive or negative, intended or unintended, or direct or indirect. So sometimes there are unintended consequences of an intervention, less so in kind of the public health prevention space, I think, than in, the medical field, but it's still important to consider that in your impact evaluations. A lot of times impact evaluations will focus just on looking at the really positive aspects of an evaluation of a program, which are still quite important. And also with the impact evaluation, this is when you can kind of look at that causal inference. Again, this is very difficult to do unless you've done a well-controlled study. So really, causal inference is limited to randomized controlled trials. There are some statistical methods you can use, but you typically need a ton of data and a lot of experience using those methods. Next slide. And then, although cost analysis is somewhat related to kind of a subset of an impact analysis, oftentimes funders and decision makers find this type of analysis to be very important. So it's basically, does the cost of a program, is it worth it, right? So you're kind of looking at weighing the costs against the benefits of a program. And there are a lot of ways you can do this. Some are far more sophisticated And in prevention, it may be simple to look at the cost of a program, but the cost savings often is quite a difficult analysis, because you're trying to kind of determine the costs associated with an event not occurring, and attributing it to a single program is often quite difficult. But you can certainly just do a simple cost analysis. Next slide. Okay, so now once you've come up with your design, you can start writing your evaluation questions. And this will take a lot of thought. So when you come up with your evaluation questions, at that time, you're also thinking about how you'll answer those questions. So it's a great exercise to really break it down by process, outcome, and impact evaluation questions, and then think about how you will answer those questions as you're developing them. Next slide. So you really want to think about what you hope to gain from evaluation. Are you looking to gain insights? Are you looking to learn information that you can change implementation practice? So oftentimes this comes from the process evaluation data, where you may be doing kind of an annual evaluation or semi-annual evaluation of a 5-year project. So you'll kind of uncover some factors that maybe are hindering the success of a program, and the process evaluation can help you come up with ways to kind of to make some changes. Assess effects, that's just simply the outcome evaluation. That is probably the most common question that evaluators want to answer. And then, do you want to affect or influence participants in some way? Again, this is really looking more at that continuous quality improvement. How are you affecting, how can you make some changes to further ensure the success of an intervention? Next slide. And I know cultural competence is, we try to infuse that into every aspect of our work, both as implementers and evaluators. As an evaluator, it's really important, not just from an ethical standpoint, but it's just good research practice, right? You want to make sure that the evaluation is really reflective of the population and the context where the program is being implemented. And that should start at the beginning of the evaluation process. So while you're planning the evaluation, you should engage a diverse set of stakeholders to ensure that there's representation from all of the cultures within a certain target population. And again, there are a lot of resources out there that can kind of help guide you with this, but I think the number one is just stakeholder engagement. And then when you're engaging the stakeholders, you're thinking about how you can design maybe your surveys or other measures, anything from focus groups or participant recruitment in a culturally sensitive manner. Next slide. And these are just some examples of evaluation questions. So for process questions, so how closely were the programs followed in terms of program fidelity for youth, parent, and teacher implementation? Was the program offered to all applicable youth, parents, and teachers? And did they attend all of the offered sessions? And how did the project align with other prevention campaigns in the school? So this is very specific to that fictitious Smarter Start program that Kim designed. The key with the process evaluation is you're really looking at fidelity and implementation capacity, trying to identify any barriers or facilitators to implementation. I also wanted to mention that when you're coming up with these questions, we usually create a table, and that has the process questions, outcomes, and impact questions, as well as the proposed data sources and the frequency of data collection. Because doing that while you're developing the questions helps you better not only plan the evaluation, but it helps you understand whether or not you can even answer that question with either the data that is already available and being collected, or data that you need to to collect. So it's really important that you're thinking about how you'll answer those questions while you're designing them.
And we have a slide with an example of that.
Oh, great, great. And then the outcomes questions, that's, you know, to what extent did Smarter Start meet the targeted goals and objectives? And then for impact, how were school district drug policies affected by the program, and to what extent were marijuana related suspensions or restorative justice actions impacted by the program? So these are more bigger picture questions. Next slide.
Yep.
Okay.
So again, depending on where, on what you're trying to do with your intervention, it's really going to dictate your target population. So going back to that theory of change, because this is really going to help guide your whole intervention, and figure out where you need to select your target population and what kind of evaluation you need to do and what kind of questions you need to ask. So in this example, my target population is the high school youth in Armstrong County, but I also need to include others in my data collection plan because the intervention interacts with more than just those youth. It also interacts with the parents and the teachers. So my evaluation's goal is to match my study population with my target population. In a perfect world, I'd go out and I'd collect data from all the youth of a certain age, their parents, and all the teachers in the county. That really might not be feasible or practical in practice. So first, I might not have a way to access everybody in the community, like the youth that dropped out of school. Logistically, I may not be able to find them. Second, I may not have the resources, the time, the money, or the manpower to do that kind of data collection from every single person. So I need to focus my intervention and sampling plan to give me the biggest bang for my buck. Since the vast majority of youth in this county are attending public school, I'm going to focus my intervention there. That also makes my data collection easier because it's kind of a captive audience, right? For the most part, and I'm not trying to track down youth at home or at various private schools. But even still, it may not be feasible for me to survey every single youth in a public school in the county, their parents, and their teachers. First of all, I can't make anybody take a survey. So I need to take a sample. The idea is that I want to select enough people into my sample that the results are going to be representative and generalizable to the larger population. In a perfect world, again, I'd randomly assign youth and parents and teachers to my study population. I'd be able to mathematically identify sufficient sample size for sampling and choose people ahead of time to ensure that there was proportionate representation in the target population. That's a really long way of saying that if I know that 60% of my school district is female and 75% of those kids are white, then I'd have X number of people, and there was X number of people per grade, then I could control for all of those variables and I would choose a sample that's proportionate to those kind of factors. I might also be able to have a control group in which I would say, in fact, here's two groups of students that are proportionate. One gets the Smarter Start and one doesn't. And we'd compare the perception of harm and we'd compare their knowledge of risk and we'd compare the drug use at the end of the study. However, a lot of times we don't have that kind of control. And that's okay. We just need to use a different strategy and understand the limitations of what we're doing because real world is very different. So a lot of times in practice, we allow people to self-select into a study sample. So for whatever reason, it's not logistically feasible to separate people into control or sample groups. Sometimes there's legitimate ethical concerns. Like if I, particularly for substance use treatment, if you have this program that you think really works, just not offering it to someone seems like an ethical dilemma, right? So we run into this a lot in evaluation of just not being able to create these two groups. So in this example, everyone is going to get the intervention, the Smarter Start programming in this scenario. And it may be that, you know, everybody that attends the school assemblies and they get the information mailed to their house. But we can't, like I said, we can't make people take a pre and a post survey. So we're only going to get information back from those people who choose to fill out the survey. So this means that our population, our sample may not be perfect. Again, not unexpected, not unrealistic, and that's okay. We might get less females or fewer white kids or fewer people from different grades submitting the information. And again, that's okay. You just have to understand and document those limitations. For example, in this scenario, I present the Smarter Start program, and only 10 kids out of 1,000 of the 12th grade report data. So if there's 1,000 kids in 12th grade and only 10 of them take my survey, probably not going to be able to generalize my results. Again, that's okay, but you have to explain that in your evaluation findings, that you can't generalize that out. SAMHSA also often talks about serve versus reach populations. I don't want to spend a ton of time on this, but I know it comes up a lot in SAMHSA grants, so we did want to touch on it. You see these terms used interchangeably a lot, serve versus reach. SAMHSA doesn't think they're the same at all. Serve populations for SAMHSA refer to the number of people who you interacted with, whereas the reached population is the portion of the target population who was impacted. So served is everybody who showed up at your door, everybody who attended my assembly, everybody who got stuff mailed home. Those are all served population. My reached population could be a little bit different. So that's based on the people that were impacted. So not everybody might have attended my my Smarter Start assembly, but if their youth had the pamphlets mailed home, those youth might still be considered part of my reach population because their parents got the information and their parents are presumably talking to them. Methods. Methods is a third part of your evaluation plan, and the choice of this design, we usually promote a mixed methods design for data collection, and the choice of this design has implications for what will count as evidence, how that evidence is going to be gathered, what kind of claims can be made about the population. So sampling methods help determine the program participants and how this is going to be involved, whereas the instruments, and they also kind of dictate what kind of instruments you're going to use and who's going to collect the data and what the appropriate methods for analysis are, because different methods of analysis have different limitations. So for all of these reasons, we always recommend a mixed method approach. That's collecting both quantitative and qualitative data from a variety of sources. Typically, we do our quantitative data collection first. So that might be conducting a survey or a questionnaire or looking at an existing data set like the NISDA. Then we use those hard numbers and counts to kind of guide the creation and refinement of our qualitative tools. So that would be something like an interview or a focus group. And so in our example, we might start our data collection by analyzing the number of people who attended our trainings and the information that we get back from the participant surveys. Maybe in looking at those numbers and responses, we notice there's a trend and we see that there are very few parents from a particular school that are completing our participant survey. So that might prompt us to ask some more questions in an interview about barriers to attending our trainings or receiving this information and dig deeper into that. So qualitative data collection in general really gives you a chance to ask much more about a person's why than the quantitative information. And it's that kind of contextual information that really give color and illumination and context to the numbers on the page. So that's why we use both methodologies in tandem to see what's happening in a bigger picture in the larger analysis. These are some examples of different types of data collection, and we're going to delve deeper into these in part 3. So today we're just going to list them out. Epidemiological data, that is really the high level data that you're finding from incidence data from states of what drug use, perception of harm, that kind of those high level barometers. Environmental scans are more observations of various aspects of your community. There's interviews, could be structured, unstructured, conversations with leaders or individuals in your community. And their perspectives, like I said, can offer a meaningful context to what's going on with substance use and substance use prevention. We've also done focus groups, which are kind of like structured interviews, but for smaller groups. And then also surveys and questionnaires. So these could be done in paper, they could be done remotely, sending email links. But these give you a chance to ask some clarifying questions and really collect some quantitative hard data. Whoop, jumping ahead. Okay. So the next step is putting everything to paper and starting to develop that data collection plan and analysis plan. So how are you going to move from your strategy to practice? What are your outcome measures? How are you going to describe them? Where are you going to get your data? And how frequently are you going to collect this? So Kim mentioned this earlier. We often use a data collection summary table. And so on the left, you see the strategies or the goals for the program. Next, you have the evaluation questions that you're going to ask. And in this case, I want to know a little bit about process, a little bit about outcome. So I'm asking both questions are about how the program was implemented and also about the effects of the program. And then next, I have my indicators listed, and that's how I'm going to answer those questions. And then I have a data source from where that information is going to come, and then frequency for how often I'm going to collect it. So this is really where the rubber meets the road, and this is really where your plan starts to come together. This is the outcome section of that summary table. Along with data collection methodology, you also want to think through how you're going to analyze the data once you've collected it. So how are you going to store the data securely? You'll want to describe the methods you're going to use for data analysis. Are they quantitative? Are they qualitative? Are they mixed? What kind of software do you need for this analysis? Who's going to be responsible for doing it? You need to give them access. How are you going to give them the secure access to the data? And how will you prioritize your findings? How are you going to make decisions about the program recommendations and what's important and what's not? Once you have a list of all your findings, these are things that you need to think about when you're putting this data analysis plan together and the components that it really should include. Kim's going to talk about some ethics and protections as well.
Yeah, and before that, there was a question in the chat about how do you determine statistical significance? And that's a very big question. I did post like a very simple answer that there are a lot of statistical methods and it depends on your design. So that's a really simple answer. I would advise if you want to do like inferential statistics. So there are descriptive statistics and inferential statistics. Inferential statistics, that's the field of statistics where you're looking at statistical significance. To do that, you do need to have at least taken a basic statistics course. There actually are a lot of free ones out there. There's a lot of free advanced courses to do some simple and you don't necessarily need longitudinal data to do. You can do statistical analyses with cross-sectional data, but ideally it would be longitudinal. So that is the simple answer to that question, but it's probably not that helpful for whoever asked that. All right, so moving into ethics and protections. So this is really focused on, because evaluations involve human subjects, we have to ensure that this is all about thinking about ethics and human subjects protection. Next slide. And the American Evaluation Association, they've identified, 5 key components to think about that are the guiding principles for ethical evaluation. That's a typo. The first should be systematic inquiry. So it's systematic inquiry, competence. So that's making sure that you're a competent evaluator, you understand good evaluation processes and methods, integrity, right? So that's a no-brainer. Respect for people, and common good and equity. And in the interest of time, I'm not going to go into depth about each of those, but on the American Evaluation Association's website, they have a very nice page that goes through these guiding principles and in detail what are the different kind of criteria for each of those.
And there's a link to them in the resource at the end. Oh,
great. Yeah. Point. Next slide. So informed consent. So typically, and I'll talk about also the Institutional Review Board on the next slide, so maybe I'll just start talking about it now. So an informed consent is really just trying to be as transparent as possible with the participant who you're collecting data on, right? So you want to tell them what they're being asked to do in, you know, detail, so they know what to expect, how that information will be used, and who it will be shared with. So again, it's all about transparency and being really as open and honest as possible, so they know what they're signing up for. Next slide. And typically an informed consent is part of the institutional review board process. Sometimes projects won't go through an IRB and they'll come up with an informed consent themselves. That is a less ideal situation because you're not an external party, non-biased party has not reviewed that consent to make sure it actually is meeting the ethical standards. So in an ideal situation, you would put your evaluation through an institutional review board review. Most universities have an IRB. They do charge for that, for using that, but I think it often is a sliding scale. So the fee is much lower for, a nonprofit compared to a for-profit company. There also are for-profit IRBs. Those can get quite expensive. I definitely advise against using them. One of the biggest issues is any change you make to any document requires additional review, and additional costs are associated with that. The thing to note about the Institutional Review Board is that it can be a lengthy process, even for a very simple study that does not require full review. So your study, you may think, or your evaluation may be very simple. You don't think it poses any risks. You put it through the IRB and they just have a lot of questions because they're liable basically, because once they approve a study, they are saying this is safe, it's a worthwhile project. There are no, real risks associated with it. So you do want to make sure you budget that time into your plan, as well as the costs associated with going through the IRB. The other thing I wanted to mention is there is a gray area on whether or not evaluations need to go through an IRB. So I think best practice is to at least ask an IRB whether or not they think the project needs IRB approval, because there is no definitive rule on that. Certainly for a research project, that is. If I came from academia, and you never would do a project that didn't go through an IRB. When you move into the applied world, there is definitely more of ambiguity on whether or not you need to. So I highly recommend, just for peace of mind, you contacting an IRB, telling them what your project is, and they can say, okay, this would be an exempt project, or we can put it through expedited review. But it's really best practice to use an institutional review board. Next slide.
And we're just going to touch on some important limitations. So as we mentioned a few times already, it's important to document the limitations within your evaluation design. And sometimes you'll know them before you even begin, and sometimes they just kind of develop. But it's important to acknowledge where the design or the planning might fall short, so that your stakeholders can understand the context in which you're making these decisions. So this also goes back to that guiding principle regarding integrity for communicating truthfully and openly to your clients and relevant stakeholders concerning all aspects of the evaluation, including its limitations. So some common limitations of the evaluation that we run into a lot are sometimes you're unable to access the target population easily because there's a lot of rural areas or no internet access. I mean, shocking, right? We're all in New England, and there's rural areas and crappy internet in a lot of places. So this we run into a lot, and sometimes it's not easy to access the target population. So we have to be a little more creative on how we're collecting our data. And maybe it's utilizing the community resources around them, or finding ways to incentivize data collection. Other limitations is sometimes there's other environmental factors that you can't control for. So COVID, social distancing, not able to meet people in person, illness. These are the big ones right now. Couldn't have foreseen any of these, but I mean, they're definitely limitations for evaluations ongoing at the moment. Also unable to conduct ideal data analysis because of data quality. So sometimes we collect data sets from other companies, or other organizations are helping us with data collection. I'm working on a project right now where a provider has sent us their set of data. There's a lot of cleaning involved in that, and I only have the data that's in the system to work with. So I can't go back and ask this clinician or ask these providers, hey, do you remember what you did on this date? Because you didn't put it in the database, so it looks like you didn't do it. So that's a limitation, right? Like if it's not in there, I can't make any guesstimates about what that was. So sometimes I can't do quite an ideal data analysis that I might want to do just because I don't have the data for it. And then lack of response or small sample size can also mean that there's limited ability to generalize to the larger population. So I gave the example earlier that if I send my survey out to 1,000 12th graders and I only get 10 back, I can't really make people take my surveys. So sometimes you just end up with small sample size. You can work with incentives, you can work with teachers, you can do kind of strategize on how to make response rates better. Sometimes you just have a small sample, and you need to address that. So pulling it all together. So now you need to make the plan. And we talked about the design and how to think about choosing an evaluation type. We talked about how to write evaluation questions depending on the purpose. We talked about different types of data collection. And then we reviewed the guiding principles for ethical evaluation. And then finally, we talked about some common limitations. So I think we have 5 minutes that we could do a quick group activity. Kristen, can you help us out? I'm going to ask if you attended the first session and you did the homework, you can kind of use that theory of change to help answer the questions. But if you didn't attend the first session, I think you're still well on your way. You could still answer these 3 questions. But we're going to put folks into groups and we're going to ask